name is Emmanuel Kweyu. I am the Deputy Director of iLabAfrica, a Research and Innovation Center located in Strathmore University in Kenya. And I'm also the lead researcher and implementer for e-health implementation projects, which is the subject of one of our applications. In this project, we are keen to raise and educate young girls and women in the rural communities on the need for early screening and also early testing and treatment of cervical cancer. Statistics show that our populations are very vulnerable, especially in the rural community. So through this project, we have a two-phase approach. One is the development of content for education. So we train community health workers to be able to sensitize the community in a culturally sensitive way using their local language, so that they're able to communicate well because of the taboo topic of sexuality around testing and screening of cervical cancer. And the second part is also to now build an application to be able to register or onboard the participant and schedule for the screening at the health facility within their locations. And then this information is put on a schedule that is now available to the nurses at the cervical cancer clinics located at the county referral hospitals and the major sub-county hospitals. The application also sends reminders, SMS reminders to the participants and also remind them on the date that they're supposed to be followed up in case after the screening their treatment course actually begins. 300 women have been registered into this and have been going to the facilities. This project has a significant impact because it has a multiplier effect in the sense that once a girl or a woman who is educated and screened, they can be able to share this information with the rest of the community. And then this rest of the community, now we expect that an increase in the number of people who are able to come freely to get screened and get early diagnosis and early treatment. So we hope that the impact here will be able to minimize and reduce these effects of mortality, at the same time educate the public on these maternal health and cervical cancer health issues. We also expect that this project is highly scalable and sustainable at two levels. One is that the software that we have built is going to be released as open source, so that it's available to the other communities, other users, not just in Kenya but also in Africa. And then the software is developed to integrate with other systems, so that it allows for usage or sharing of information from this system to other systems that may exist in the hospitals. The technology is freely available, it's affordable, and it's cheap. So our research center will continue supporting upgrades and updates as part of ensuring long-term sustainability. We are hoping that to liaise with the National Cancer Institute and also the Ministry of Health at the national level. We are now looking at additional support from other partners to be able to scale this. Our aim here is that at early detection and early prevention, we can be able to prevent progressive of these diseases, which become more expensive to manage at a later stage. Thank you.